We're going to take a look at injury assessment. This is in addition to the additional assessments that you learned in Level 3, your subjective and objective assessments including postural and gait analysis. This is just an extra focus on what additional information you would need to look at subjectively and objectively if a client presents with injured tissue. The world is full of obvious things which nobody by any chance ever observes. A quote by Arthur Conan Doyle which I think sums up what we need to be as therapists. Sometimes something so obvious that the clients themselves don't see why it may be playing a part in their injury. So we are here to be that mirror to reflect back to the client and to ask those probing questions that allow the client to explain to us how their activities of daily life, hobbies, occupations, and the injuries themselves may have a bearing on the outcome of your session. So why do we assess our clients? One, straight up, the red flags. We learned this early on in the sports massage. We need to ensure that it is safe to massage our clients. So that's the number one reason we need to screen thoroughly. We need to look at both subjective, what our clients tell us, as well as objective assessments, our range of motion testing, postural analysis, and a new tool that we will teach you today. This will help us paint a whole picture of what's going on with the client. To one, tell us if there is an injury, what stage of that injury, what type of injury they have. Remember, we're not assessing to create a diagnosis. That is not our role. Stay in your lane. But assessment can absolutely help us refer to find out the clients where we need specialist input, specialist assessment, or diagnostic tools. So it's really important we do this to make our clients feel safe and to ensure that we are treating clients appropriately, or not in the case of a referral. So let's recap on our two types of assessment tools. One, subjective. All of those level 3 questions still apply, but it's time we get a little bit deeper and question a little bit more when it comes to injured tissue. Things like onset, the pain descriptors used, worsening and alleviating factors, times of days. We need to start getting an idea of the intrinsic and extrinsic factors that apply. Objective, all of our existing assessments still exist. But if someone presents to you with an injury and you're unclear as to whether or not you're able to treat them, what stage of healing they're at, we're going to give you some additional tools today to help you add an additional objective assessment which will help you identify what stage of healing that client is in or whether or not they need to be referred. It's going to include visual assessments, so checking for heat, swelling, redness, cold, being more specific with our palpation. Are you palpating tendon, ligament, muscle, bone? Recapping all of those tools and adding to them. So in terms of our new subjective assessment, nothing is new here, other than the fact that we're talking about a very specific injury or pain. We want to be open-ended at first. Get your client to describe the issue. This is really important as the words they use can help create a picture of what might be going on. It provides the client with an opportunity to tell you all of the details that they consider important to coming to you and to that injury. And there may be some important elements here for you to consider. Now that you're getting a better understanding of the problem, we want to get more specific. We start asking questions like, when did it occur and how? Was anything out of the blue? Anything different than normal? Was it an activity they usually do? How frequently do they do it? Or was it something new? How does it feel today? How has it felt since the injury? Where is it? Show me with your hand, show me with your finger where you feel the pain. Does it radiate? Does it stay? Is it constant? How would they describe it? It's important we listen to the words they use, as we want to understand whether they're describing symptoms that are in the acute stage of injury, or maybe something that needs referral, like something with a neurological impact, like numbness, tingling, burning, shooting pains. We also want to understand if they're talking about more chronic type issues, dull, aching, stiffness, regional pain, things that might indicate trigger points, hypertonicity, or chronic term issues. Onset is really important, and also what they think caused it. Was it sudden? Has it been building? Is it a gradual onset? And what do they think caused it? I think this often shows us a lot of what's going on. Often a client can think they know what's causing it, and it's not, but sometimes it holds a clue to the problem. And especially when it comes to things like persistent pain, chronic pain, long-term issues, the fact that they think something is causing it might be part of the solution too, and helping to change that mentality and changing how they look at certain activities can have an impact and bearing on that pain. In terms of your objective toolkit, we're going to give you one more tool to help you identify what soft tissues may be damaged and to help fuel that treatment plan. We're going to do 3 tests on the target muscle or target tissue. 1, an active contraction of that target muscle. 2, an active resisted. And 3, a passive stretch. For each of these tests, we're going to ask our client if they feel pain, and if they do, when do they feel that pain? For example, on initiation of the movement or contraction, or at end of range, and where. And those 3 pieces of information are going to help us understand the pain behaviours and therefore what tissues may be involved. So this simple table, it's not gospel, but it certainly gives a good indication as to what's going on depending on when and where your client feels pain. So first of all, muscle. On active contraction of that muscle. If there's a muscle strain, then the client would feel pain on initiation of that contraction. And they would feel it in the muscle belly. Hence why it's important we ask when and where. Next, we'll do an active resisted contraction, so against resistance. Again, if your client feels pain, where do they feel that pain and when? Again, in the case of a muscle strain, they would still feel pain on initiation of that muscle contraction. Thirdly, we're going to stretch that target tissue. And if they feel pain on stretch of that tissue at mid to end range, then those are all indicators that it's likely muscles that are involved. Next up is tendons, same 3 tests, active, active resisted and passive. Same thing here, if your client feels pain, where and when. And the key differentiator here is the where. So they're still going to feel pain on initiation of the contraction, the difference being they'd feel pain in the tendon. So get your clients to show you where they're feeling the pain. Active resisted, same thing, pain on initiation of that contraction, but in the tendon. And again on the stretch, they would feel the pain in the tendon. Next up is ligament. So if we do an active contraction of the muscle, but they're only feeling pain at the end of range, well then this is indicative that it's not necessarily muscle or tendon, but it could be ligament pain. In the case of an active resisted contraction, they would feel no pain if it was ligamentous, because the joint is not moving through to end of range where the ligaments would be involved. And then on passive stretching of that muscle, again because we're stretching to end of range, it's likely that pain would be felt in the joint around the ligaments. In the case of a bursa, so bursitis, inflammation of the bursa for example, on active contraction of the overlying muscle, your client would feel pain at the location of the bursa. In the terms of active resisted, same thing. As that muscle contracts, your client would feel pain at the location of the bursa, but your client would not feel pain on stretch of that overlying muscle. And in terms of the joint capsule, it's similar to the ligament, where really clients would be feeling pain at end of range. But if it was an issue with the whole joint capsule, they would be feeling pain at the end of many ranges rather than 1 or 2 in the case of specific ligament sprain. There would be no pain on active resisted for the same reason we're not going to end of range to strain the joint capsule. And on passive stretching, again, the client would feel pain at the end of many ranges if it was an issue with the whole joint capsule. So just by performing those 3 simple tests, active contraction, active resisted contraction, or a passive stretch, we will be able to determine if we need to refer this onwards if we suspect joint damage, bursa inflammation, or something outside our realm. If it's muscular or tendinous in its behaviour, then there are lots of things we can do with our treatment plan, and we can adapt our home care to suit those specifically. So I'm going to show you a number of assessments, 4 or 5 examples, just to show you in practice how you would do those 3 tests. But I'm going to just talk you through the case of a hamstring here to get you thinking on the right lines. This client comes in, complains of hamstring pain towards the knee. So it's unclear whether it's muscle, tendon, maybe ligament or a joint issue. So we want to perform these tests to help us narrow it down. The hamstring crosses 2 joints, remember, so it's a little more complicated. It crosses the hip and the knee. So we want to test both the origin and the insertion. If your client is complaining of it local to the hip or knee, that makes it simpler. But if they're talking about general pain in the hamstring, then I would be testing across both joints. So our active contraction is going to consist of a straight leg raise in prone, so a hip extension, and also a knee flexion in prone, as the hamstrings extend the hip and flex the knee. Active resisted, same movements, but against resistance, not moving through ranges of motion. And finally, our passive stretch would be a straight leg hip flexion in supine and a knee extension in supine with the hip at 90 degrees. We would just simply do those 6 movements, those 3 tests across both joints, and depending on when and where our client feels pain, will help us understand what might be going on.